Well, hello and welcome to today's HIPAA Chat. We are going to be talking about security risk analysis and requirements for the next hour and taking questions from our audience. If you've attended HIPAA Chat before, welcome back. And if you're new to HIPAA Chat, well, you're probably in for a different kind of webinar experience. HIPAA Chat is sponsored by EFAX Corporate, which is a brand of J2 Global. They are a leading provider of internet services through its two divisions, its business cloud services and digital media. Please visit them online at enterprise.efax.com. Our host of HIPAA Chat is Steve Spearman. Steve has spent several decades, actually, now in the security area and in healthcare. He is the CEO and founder of Health Security Solutions. He does some work for some of the RECs around the country. He is our high-tech answers, for lack of a better term, in-house expert. And hopefully it's okay that I say that. And as you can see, there's a striking resemblance to George Clooney joining us. Yeah, joining us.
I get that a lot. Yeah, I get that a lot.
Joining us back again. We had so much fun last month in October. He's back again with us, Rob Humphreys from EFAX. Rob also is a security expert and is a product manager with EFAX Corporate. And you can see his resemblance to Brad Pitt. George Clooney, Brad Pitt, together I call this dynamic duo Cloonit.
I'm thinking Zach Galifianakis, actually, Rob. I mean,
Zach Galifianakis is definitely a little closer.
Yeah.
I'm sticking with Brad. Hey, if you can be Brad,
okay.
if you can
That's
be Brad,
right. If I can be George Clooney, then Rob can be Brad Pitt. Yes,
and I can be Jennifer Lawrence, right? We're still on board with that. Okay.
Yeah.
J-Law, yeah.
Of course.
So just J-Law. So just to remind our audience, especially those that are new to HIPAA Chat today, we've got a couple slides to go over with Steve, and then we are going to dive right into the Q&A. These are the questions that you guys asked during registration. We're going to try to unmute a couple of you and bring you on live because that's always fun. And Steve, just take it over for right now, and then we'll get writing these questions.
Well, as usual, we're going to just start with a few slides, kind of very high-level sort of things. And I think it would be worth starting with this. This is literally verbiage from the HIPAA regulations, and it says that the goal, or what you have to do in order to meet this requirement, is to conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information. One of the things that's interesting about that statement is that a lot of people, when they think about risk analysis, they assume that it's just concerned with confidentiality, but really you have to kind of investigate things related to integrity, integrity being making sure that charts and records cannot be inappropriately altered or deleted, and then availability as well, making sure the data is there when you need it. So, which leads us to our next kind of natural follow-up question. What is a risk analysis and how do you do it? And so we'll start with the how-to. I used to say when I give webinars and when I speak in front of people, I'd say somewhere between writing "I'm okay" on the back of a napkin and a 10,000 page report, somewhere between there is an acceptable risk analysis. And yeah, I'm not saying that the 10,000, I'm sure the napkin would be problematic, but the 10,000, I don't know. I mean, if you can find somebody with the patience to read it, but, and I kind of think, well, who do we have to please? Well, really we have to please auditors. So, and that's kind of that's what informs this question. What would an auditor want to see? And so the best fallback guidance we have, and there's others too, is the NIST Special Publication 800-30, Guidance on Risk Assessment. And what's interesting is the regulations don't actually spell out how to do a risk analysis. It's not like that if you did something other than what the NIST says that you, quote, will not have complied with the regs. There might be other methodologies that are perfectly appropriate as long as you do what we just read in the previous slide, is that issue of the confidentiality, integrity, and availability of EPHI. But it's kind of our best go-to because it's the one that federal entities have to abide by. It is the one that in both meaningful use documentation and in HIPAA documentation, it's the one that's pointed to all the time. So it's a pretty good standard to kind of to live by. And then 866 is the resource guide for implementing HIPAA. It has a very useful appendix. Appendix D is the crosswalk. And then the audit protocol is another really important one in that, especially right now as OCR is gearing up their stage 2 for HIPAA audits. And they published a protocol in June 2012. And then I actually think one of the more important documents was published in April of 2012. It's the ONC Guide to Privacy and Security of HIT, and in that they clarified a lot of myths that had evolved following meaningful use about what was acceptable, and that's also a great guide as well. So next, what should a risk analysis do? Now this is a very 10,000 kind of, even though it's practical, it's sort of like, okay, here's broadly what they need to do. You need to identify the IT assets that touch EPHI. You need to clarify how information flows into, out of, within. I call it information flow analysis. And so that allows you, those two things together allow you to define the scope of what you need to think about in terms of what the risk analysis should do. I believe that the policy compliance piece is really important as well. Like, what is, that auditor is going to care a lot about what policies you have that actually map and meet the regulations. So a mistake that people make is they think that that's all they need to do, is that we just need to make sure we have policies governing X, Y, and Z. And the problem is that having policies governing these things does not in and of itself meet that slide A requirement to identify risks. So so even though it's important, don't assume that that's all that needs to be done. And then through this process of analyzing information and policies and your technical vulnerabilities, you want to be able to identify and categorize the risks to the CIA of EPHI and recommend and rank standards and controls for remediating, mitigating, and managing those risks. And so common errors that I think people make in their risk analysis is a lot of people use checklists only. I get asked a lot, can you send me a risk analysis checklist? Now, a checklist is a very useful tool. But literally the main issue here when we say checklist, it's going back to that statement I made about policies. Policies in and of themselves don't meet the requirement. A policy checklist doesn't meet the requirement. A checklist that's part of a legitimate and real project plan to conduct risk analysis, as you're checking the different tasks off, well, that's kind of close. So a lot of risk analysis I see don't have any sort of inventory. It's hard to argue that you covered the scope that needed to be covered if you didn't do an inventory. They're compliance focused. There's no place does it actually recognize, does it list or rank the risks. There are no controls. And for meaningful use purposes, one of the things is it's not data, you didn't do it within the required time period. So those are common errors that we find. And so anyway, let's jump in.
Yeah, we're going to jump right in and just a couple things to our audience. We're going to be addressing questions that were submitted during the registration. If you didn't ask a question and would like to ask a question, please use the question box on the right-hand side. We may not get to it in all likelihood we won't, but the system will capture that question and then we will try to respond back to you offline. If during the registration, if you indicated yes or maybe that we could unmute you to be live on our program today, if you called in, if the answer is yes, if you called in, you'll be sent an audio pin when I unmute you. If you use voice over IP, you'll automatically be unmuted. So I'm going to be looking for you in the attendee list and chatting with you privately to see if you're good to go with that. Little instructions never. Yeah. Okay, so I'm going to just dive right in. And first question is, what additional resources do you recommend to document the technical items of a security risk analysis?
Read that again.
Yeah, what resources do you recommend to document the technical items of a security risk analysis?
Okay, the technical items of a risk analysis. Okay.
Screenshots,
yeah, that's right. Yes, yeah, things like that. Okay. Well, first of all, let me just say I'm going to start with a global answer to that question. The ideal thing that a person would send to an auditor, whether it's a HIPAA audit or more likely a meaningful use audit, the ideal thing to send is a thing called a risk analysis report. It is a thing that will do what we talked about in the first slide, and it will present that data in a formalized way. That is the documentation that you want to be able to send. Now the question is kind of about like proving technical aspects. And so, you know, if you're, to the degree that you're doing technical assessment, and I think everyone should do at least some technical, then usually those tools will provide reports themselves. Like if you use a vulnerability scanner of some kind, it'll do a scan and then it will tell you the threats that exist on what are called hosts, which are individual IP addresses, and that would be a great thing to attach. Another piece of documentation that would be great to include would be, like, if you talk about screenshots, you could do a screenshot of your firewall security settings. So let's say you have a sonic wall. You have a sonic wall, what I call UTM or firewall. You know, take a screenshot of that and include it in the report that shows that you've enabled what you've enabled and disabled. A lot of times those firewalls are able to themselves generate activity reports, and specifically activity reports like, hey, who's been trying to ping my website, and
yeah, sure.
Yeah. Active Directory, some of you may use Active Directory. Active Directory has a capability called security event logging. I would recommend that you enable security event logging on your Active Directory, and then that is something you can also have reports that kind of prove that. So those are all things that I have used, and that could be appropriate proof of kind of technical competence. And Rob, I don't know. What are your thoughts?
Well, yeah, I mean, the thing that I would say, Steve, is just along the lines, extending at a little bit more of a high level what you said. I think it's important not to have these things get too splintered or branched. The tools are there and they're certainly available, but like you say, for ease and just presentation in an audit scenario, or just to kind of relieve the headache on your own side, it certainly makes sense to consolidate all of this stuff into a single final report, no matter what sort of resources you're using, just so that you can have a Bible somewhere of your RA work.
Yeah, it's a great point. I mean, and I know you're kind of echoing what I said, so that's a little self-aggrandizing. But anyway, it's that I've reviewed risk analysis where literally you kind of felt like, hey, the consultant, like, we really want to show we really mean it. So they just kind of throw everything into this thing, and huge document, that's like, and I'm not going to completely be dismissive of that, but what we do is we do a report that kind of is focused, and then we provide our clients with an encrypted thumb drive that has all the supporting documents, and that usually has hundreds of more pages. Our typical report is probably about 60 pages. But the appendix, the digital appendix, has hundreds of pages usually of supporting documents. So to your point, I think that some people here on this call are not going to have that formalized report, and so they're going to need to be able to reference some of the things that we just talked about. But ideally, it is going to be more. It's going to say here's what we've got. And that appendix is more almost like for support purposes. So.
Right.
Okay.
And getting closer to the 10,000 page mark, right?
Yes, exactly.
Sure. Yeah, really. How frequently would you guys recommend a security risk analysis be done, and are there specific triggers for that frequency?
Okay, so the rules, gets interesting, okay. HIPAA doesn't say. That's the first thing. The actual HIPAA regulations don't specify a time period. However, meaningful use does specify a time period. So if you are a covered entity who is involved in meaningful use, high-tech, grant program funding, blah, 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 you have to do it every year, and it has to be done during or prior to your reporting period. And I don't know, we may be talking about some clarifications around that recently have been made, but that's what I'm going to stick to for now. It's just, so HIPAA doesn't actually say the risk analysis should be done annually. The rules do allow for what's called a review, and you could review or update. And so I recommend that people do a full risk analysis every 2 to 3 years with a review or update in between, in the between years. And but there, pursuant to this question, there are kinds of events that would warrant, regardless of when you did your last risk analysis, that would warrant doing a full risk analysis again. Like if you were changing core systems, going from next-gen to eClinical Works, or maybe moving into a new building, or significant changes in your operations would warrant a full risk analysis. That's my answer. I'm sticking with it, despite the recent confusion that
there was
CMS has inflicted upon us.
Yeah.
Did anybody ask about that? Did we get any questions about like the when you have to?
Yeah, we got several questions related to. We might as well segue into this conversation real quick. We've got several questions asking for meaningful use. Do I conduct a security risk analysis during the reporting period, or can I do it in the calendar year? And so I think that sort of is my lead-in to this issue that Jim Tate posted about it yesterday, and I know you've been actively involved in the conversation as well.
Yeah. So that as Jim called it, the rabbit hole. So CMS recently published an FAQ. They, I think, initially published it on October 6th, in which they said that that you could do it any time during the calendar year of your reporting period. So let's say this year, you used a calendar quarter. So let's say you did a second quarter. The implications of this FAQ was that you could do your risk analysis in November, this month, and that you'd be in compliance. And that was a dramatic change over anything we'd ever heard. And in fact, Jim forwarded it to me, and I said, this is a major change, and yada, yada, yada. And we both speculated at the time that they were going to probably need to change that it's such a change. It was so contrary to multiple written documents, and indeed, that's exactly what happened.
Yeah, they were quick. Yeah, they were quick to react. Yeah.
Yeah, within a few weeks, they had actually updated the FAQ. They didn't put any kind of notice or anything like that. Didn't put any kind of notice or anything like that up there, and they changed it. What was interesting, even with this change, the change is not what we've been made to understand as well. So historically and in current documentation, guidance documentation from CMS, it says that the risk analysis has to be done prior to or during during the reporting period, but not afterwards. It makes that clear. It has to be done by the end of the reporting period. And in this most recent document, they said it can be done prior to a testing, which is, again, itself a change. I am advising all of my clients to not take any chances and to do their risk analysis prior to the end of their reporting period. So, if somebody asks me, hey, when do we have to do it, I send them the CMS guidance, which says prior to the end of the reporting period. So, yeah, there's a little bit of muckety-muck kind of going on with that, and I would, I would stick with the original, understanding, so to speak.
Right.
By the way, but Jim's right if that was fantastic. He even provided a Google cache of the original. He
did.
Which is great.
Google, right? Yeah.
Google, right. Maybe we can provide that link to that article in our follow-up. So.
Oh, that's a good idea. Just FYI, I just unmuted. I'm sorry, go ahead.
I was just going to say, Steve, did you get the sense as part of the conversations you were having on this that they were going to look to provide any additional clarification, even if they, throw it up on the site and, as almost a secret update again to the FAQs, or
yeah, that's
would
a
it
really
just be
good question.
safer to go with the original?
Yeah, that's a great question. What I basically I think that they're not going to update that FAQ any further. I mean, they may. Let me put it this way: this question gets asked and kind of updated in various and sundry FAQs. I mean, you can go and find FAQs going back years that kind of deal with this question. They've always answered them consistently until this one. I think that probably CMS is going to just. I would imagine they're just going to kind of point to other current documentation. I don't think they're going to come out with something like an oops or mea culpa or anything like that. They just, I've had clients wonder, like, well, if we provided documentation that, like that Google Cache, for example, you think that might buy me anything, and I just wouldn't want to bet on that,
Sure.
So we'll see. I mean, we'll see, but.
Yeah.
Our government hard at work, I guess. It's my
Yeah. I'm actually trying to bring Terry from Joplin, Missouri online live. Terry, are you there?
Yeah, sure am.
Oh, hey Terry. Well, welcome to HIPAA Chat.
Thank you.
Oh.
Hey Terry.
Hey, welcome aboard, Terry.
Hey guys, thank you.
Yeah.
Hey, so a question about just differentiating risk analysis from evaluation, and so some of my in some of my history, it was commonly believed that and we believed that we were able to accomplish both in kind of a consolidated manner. So in one case, an organization I worked with, we brought in a third party to come in and effectively perform both risk analysis and evaluation in something that was called risk assessment. And I guess I'd like to hear you talk around that a little bit and maybe differentiate that for me and help me understand if risk analysis is even possible to be done as part of evaluation, or if they are just completely two different things.
First of all, great question. I mean, this is a fantastic question, but I think it may benefit our audience because they're not sure what you're referring to with evaluation. So let me back up just a little bit. So the very first HIPAA security regulation is the risk analysis implementation specification under the risk management process standard. So the first standard is risk management process, and the first implementation, what I call safeguard, is risk analysis. Okay, so the rules are divided into standards and implementation specifications. There is another standard called evaluation, and that's what Terry is referring to. The evaluation standard basically says organizations have a requirement to periodically review their security stance, and in the event of making strategic decisions around information technology or changes to their environment, they need to evaluate its impact on the security of information. So, and the answer to your question is that absolutely, I believe security risk analysis is a fundamental part of evaluating those kinds of things. It's that, so the real answer to this is that within the rules themselves, I cannot say, oh yeah, the evaluation standard, oh yeah, you got to do risk analysis to do that. But given that there's so much intersection between what you're supposed to do to evaluate and what you're supposed to do from risk analysis, they definitely, I believe, should go together. And the right way to handle that is you should have a policy that describes your evaluation. You should have a policy, as you should for all the regulations, governing evaluation, and that policy could very well point to your risk analysis procedures as a part of that process, and should include that or incorporate that in the language. So the other point that I would like to make that I think is kind of where evaluation, just saying, yeah, we evaluate, look at our risk analysis process, maybe not sufficient by itself, is because I think an evaluation policy should also govern like when are the types of things and when you should evaluate. Because it shouldn't just be based on like how often. Like as I said, the rules themselves don't say how often you need to do risk analysis. But I do think for evaluation, you should have some language that says, you know, if in the event that we're going to have significant changes to our operating environment, our evaluation policy requires that we conduct risk analysis so as to understand the security implications of that decision. And lastly, my last sort of point is to say that the way that you demonstrate you meet any regulatory requirement, whether it be risk analysis or evaluation, is in your policies and procedures. So your policies govern these things, and then many of your policies will have supporting documentation that you would show to an auditor to prove that you're meeting it. So Terry, did that kind of answer the question, you think?
Yeah, and that's helped. Yeah, I think so.
Great.
Yeah.
Thanks, Terry.
Sounds good.
Thanks for participating.
Yeah, we like the ones going live. You get put to the top. Your question's top of the list. You get your preference.
Before I find another victim, participant.
We never asked Terry who his movie star doppelganger is.
Oh yeah, the Avatar.
Yeah.
Terry, you got to
Yeah.
Terry, if you
I was
chat
getting
that.
kind of a Ryan Reynolds-y vibe.
Kind of
Terry.
vibe, yeah.
I was getting that too. Terry, you're going to have to chat that to me so we can tell the audience who you resemble most. And he just said what vibe?
Or least.
He might have missed the opening Avatar joke. Yeah. So next question, and I actually I really love this question, believe it or not, and for both of you to weigh in. But what will it take to get HSS and OCR to clearly define, in parentheses, a thorough and complete risk analysis?
This is an interesting question, and it's interesting and a little subtle. This is the thing. One of the things that I like to remind people of is that the rules are intentionally vague, right? I mean, do you really want rules that say you have to have this in place and your settings need to look just like this, and you need to? It's like they want people to think about these things, and so I understand the spirit of the question. I really do, and I try to, but it's like if you get too specific, then are we? Well, let me go back up. I tell clients this: when you're kind of developing policies and procedures, there are two things you want to avoid. You want to avoid them being too broad, and you want to avoid them being too narrow. So the reason you don't want them too broad is because you can't prove that you ever met the requirement. This is really the spirit of this question. It's that, hey, the rules are too broad, they don't give us enough instruction, and to which I totally understand that, because if something's too broad, if you have, for example, a policy around information system activity review. If you don't define it, have enough specificity, you can't prove you met it. That's the thing. But if a policy is too narrow, then it's confining. It's like you have to make sure you jump through this hoop this often, and document that this way, and so you want to find that balance. And my practical follow-up advice would be the following. It would be, when it comes to risk analysis, have it reasonably well defined in your policies and procedures, and that will be good enough. I don't expect the government's ever going to come out and say, you have to follow NIST 800-30, or you have to follow, COBIT standards for risk analysis. And I'm not sure we would want them to do that. But the way that you can satisfy the government is by having a security risk analysis procedure that's defined and that helps you meet that first slide, identifying risks and vulnerabilities to confidentiality, integrity, and availability of electronic protected health information, and then you'll be good. So that's a little philosophical, quasi-political, and but that's I understand the spirit of the question. I think that absent them being real granularly definitive, address it in your own policies. So.
Right.
Yeah, I mean, I don't think they're looking to handcuff anybody from a technology perspective, kind of as you say, Steve. And I guess the question, because you hit on it with the term spirit, do you get the sense that if you are making a good faith effort to have these policies in place within the spirit of it, even if we don't have the letter of the law spelled out, that is going to satisfy those requirements when you get faced with it?
Yeah, I mean, yeah. Well, first of all, good faith by itself won't save you, but good faith with a little bit of conscientiousness will. So
right.
if you have a policy governing it, you can reasonably document compliance to that policy. So in the case of risk analysis, it'll be a risk analysis report or something like that, as we talked about earlier. I think you'll do fine. I think you'll do fine.
It's really that the little bit of understanding I have, the key issue is that sort of that willful neglect, right?
Yeah, and willful neglect is actually a legal term.
Yeah.
Willful neglect, and this is really true, willful neglect, there are categories of fines within the HIPAA rules. Willful neglect is the category, there are two categories of willful neglect, and you don't want to be in either one of them. There's willful neglect that's corrected or willful neglect that's uncorrected. So, yeah, and the reason you don't want to be in either one is that these cases are adjudicated. I mean, this is my big word hat, okay? I just do it one show, they're adjudicated by an administrative law judge of the Office of Civil Rights of the Department of Health and Human Services. Yeah. In case anybody wants to write that down, these cases are adjudicated by an administrative law judge of the Office of Civil Rights of the Department of Health and Human Services. And if that judge finds in their discovery decides that you are willfully neglectful, he must fine you by law. He cannot say, I know you guys are well-meaning and it's been he has to fine you. Whereas if you're in the one of the other two categories is reasonable cause or actually did not know. If you're in those categories, he can waive the fine, and we'll do that often. So you want to be and again, the kind of comment that Rob made, that's what determines whether you're willfully neglectful.
Right.
If you have no policies, if you don't have a risk analysis, sorry, you're going to be found to be willfully neglectful. Or if you don't have policies governing these things, sorry, but you're going to be found to be willfully neglectful.
I'm going to move on to from a philosophical discussion to a technical. Do you believe HIPAA data at rest? Does that apply to large databases, or is that just on mobile media devices?
So the answer is it does. Yeah, I'm going to give you a quick, straightforward. It does apply to large databases. And the question pretty clearly is talking about encryption, and I suspect that what they're really talking about is it might be derived from the meaningful use stage 2 language, which has some language about encryption. But let me say this, that encryption, whether it's meaningful use stage 2 or whether it's HIPAA itself, is the two places it's discussed is in both cases it is an addressable safeguard, which doesn't mean optional, but it means that if it's not reasonable and appropriate, you don't have to do it, as opposed to a required safeguard. So the answer is that if you have data in databases that's in, let's say, that are on servers that are in a secure data center, the one thing we don't worry about at all, we don't worry about physical security of those servers, right? We don't worry at all about it. There's no way that, in a certified data center, I say no way. Stealing that kind of server, we're talking Tom Cruise, Mission Impossible kind of stuff. It's Rob.
Yeah, it's not, I think that's maybe a concern if your data center is your mom's basement.
Yeah.
But a real certified, like you say, hosting facility, physical access is likely not the concern.
Imagine Rob, Rob and his Zach Galifianakis, hanging from the ceiling. Make sure that's what we're talking about. It's like we don't really
with Carlos
worry.
the baby on my stomach.
Absolutely, yeah.
Some data center in the middle of Nevada.
Yeah. Exactly. Yeah. It's like so we don't worry about physical security at all servers in that case. But the reason encryption is still potentially relevant is because you can still hack a server, and encryption is another layer of protection for that. And so and let me say that one of the requirements for Stage 2 for certified Stage 2 software, is that the databases have to be encrypted when they're delivered to you, according to Stage 2 certification requirements. So now you could still disable that encryption under the rules if it's not reasonable and appropriate, and if encryption as an example, if encryption dramatically affects performance, and disabling it, which can only be done by an administrator, really speeds up latency, improves latency as an example, then you could document it's not reasonable and appropriate. So I will say though, if you go look at the Stage 2 rulemaking on this, the topic, it is pretty clear that they care a lot about data at rest on mobile devices, that's a big driver of the concern. And so, either, like if you got mobile devices that are, going hither and yon, and you got data that's on them, that's PHI, then you've got, even, it's still reasonable and appropriate, but, you really, 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 really need to look at encrypting those devices.
Yeah.
Yep.
Just as
I think just make sure that you don't forget that laptops were sort of our original mobile devices.
Right.
These days, people sort of think of mobile as handsets and tablets, and where we've seen a lot of breaches that are around the laptops and stuff that can get out of the office. So just make sure you expand the category.
Yeah, think of them as media devices, and just a quick segue, there's a white paper by eFacts on our High Tech Answers website under White Papers, 6 Steps for Securing PHI and Mobile Devices. So our audience, you should go there and download that. It talks about that,
Did y'all hear about the breach last week that was announced?
Yeah, you told me about that. Tell the audience, that's really horrible.
So I just I showed this to one person. He's actually kind of like skeptical. So a physician was apparently robbed at gunpoint and apparently tied to a tree and apparently told at gunpoint to he had to give up his password to this laptop that was stolen that had about 1,000 records on it. And so that'll be interesting, assuming that those details are true. It'll be interesting to see how that is adjudicated, because that's a breach for sure. The data was not encrypted if you were able to, if the password, was given, it decrypted it. So that's going to be an interesting case to watch. So anyway,
see what happens. That's horrible.
Yeah, see what happens. Yeah,
horrible. Alrighty. Can you discuss? You sort of mentioned Stage 2 MU, but just probably MU in general. There's been talk on High Tech Answers, and you've blogged about this, and we've had webinars on this, discussing that SRA is definitely a culprit for EPs and EHs who are failing or may have failed an MU audit. One of the registrants wanted to know, do you know how, what percentage that is, how many, why that's the case? I think we know why, but it is interesting. It's one of the linchpins, isn't it?
Yeah, so in case any listener doesn't know, I did a Freedom of Information Act request back in February of last year, and I had low expectations, and lo and behold, back in September, I got an email with basically data on all the audits that have been conducted for meaningful use. It was kind of amazing, and there's an infographic that I've produced in an article, and maybe I'd like to we could send out a link to those things. About between 20 and 25% of eligible providers have failed their audit, and we know that. The data that I received from CMS, basically all it said in terms of the reason was either failed because they weren't using a certified health record, which was an astonishingly low percent, like 2% failed for that. And then the other, it just says failed to meet meaningful use requirements. So it didn't say whether it was because of risk analysis or whatever, but we know from a lot of anecdotal data, we know that the primary reason that people are failing their meaningful use audit is because they failed to do an inadequate risk analysis.
Yeah.
And so it's important. And as we've already talked about, you need to not only do it and do a good job, do it within the time frame that meaningful use requires. And this is, I think about everybody's finally figured out you can't ignore this step because it's gotten a lot of press.
It's gotten a ton of attention. Yeah.
Yes.
Yeah.
Hey, y'all go look at my infographic. I'm so proud of my infographic.
I promise you I will send that infographic out. When I'll email everybody that some questions are coming in about, the recording. All of the registrants and attendees will get the recording of today's presentation, the PowerPoint. I promise I will send along with that the link to download the 6 steps for securing PHI on mobile devices by eFax. I'll send you Steve's infographic. And I'll probably send you.
Which is lovely, right? It is a lovely infographic.
It's pretty cool,
right?
yeah.
It is a beautiful infographic.
It is a beautiful infographic, yeah, as infographics go. And and I'll probably send you
what are otherwise boring subjects,
right.
But yeah.
I'll send the link to Jim Tay's post, and I'll probably send you 5 other things. So this will be the 10,000 word email that you get from.
Right. I'm sorry we've burdened you, Carol. We're just a burden.
No worries. Yeah. So next question. This is kind of interesting question because obviously practices vary from one doctor to hundreds in hospitals and whatnot. Do the security risk analysis requirements change by practice size?
This is the scale question. Rob, I've got an answer, but I'm curious what you think. How do you think about it?
My sense of it is you've already kind of touched on it. It really is the scope of what needs to be assessed as part of it that really is going to impact where you get into it. I don't think the questions of thoroughness or the topics that you would touch on necessarily change at all. But it definitely is one of those things. Again, where it's your infrastructure is going to be significantly smaller. The applications that you have deployed within your practice are going to be slightly different. But it's in terms of a meaningful change, I would say no. But
yeah, I totally
correct me if I'm headed down the wrong path.
No, I totally agree. I think that the scope is. So you have to I'm going to keep talking slide A. You have to do it slide A. It doesn't matter what size you are. But the amount and the way and the kind of work needed to do a 2-physician practice with 12 computers has a level of complexity that it's not going to have the same level of complexity as a 40-physician, 200 employee practice with 9 locations and 225 computers. With a data center on site, all those facts. Yep. So, and I kind of do everything. One of my favorite lines of business is what's called risk analysis in a box light. It is for 1 and 2 doc practices. I feel totally comfortable, but the data gathering process for that is, much simpler and easy. I call it a remote facilitated risk analysis, and it's just like you said. It sort of scales based on size, complexity, and scope definitely changes for sure. So,
excuse me. So, I'm going to unmute Najeen. Hopefully I'm saying that correctly. From Anderson, South Carolina. Hold on one second. Najeen, actually, an audio pin was just sent to you, so go ahead and enter that audio pin, and that will unmute you. And as soon as you're unmuted, we'll get your question in front of Steve and Rob. So hit the audio pin and say hello.
Najeen, I think, yeah, she's in my backyard. I think we've talked before.
Have you?
Yes.
Najeen, are you there?
Najeen?
She has to enter an audio pin that I just sent her, so hopefully that will. We'll see her in a second.
Yes.
So we'll ask another question while we're waiting for her to join the line. Is a security risk analysis beyond a business agreement required for cloud-based systems? If you're a hospital, obviously they have cloud-based systems that they're working on or using, and probably maybe another third-party.
Ask it. Read it again one more time.
Yeah.
So I want to make. Is this about business associates or about risk analysis or both?
I think it's both. So, is a security risk analysis beyond a business associates agreement required for cloud-based systems?
Okay. So I'm going to answer this in two parts. First of all, your cloud-based vendors that are handling PHI definitely need to sign a business associates agreement. Just get that out of the way. You definitely need one. But I think the question is kind of like, do we have to conduct a risk analysis for our cloud-based vendors? Like, do we need to? And the answer is, the thing that governs that is your business associates agreement. And if a cloud vendor is signing a business associates agreement, they're saying we're going to comply with the rules, and the rules require risk analysis. So one of the things that that I end up having, it's kind of a little bit more of a more technical aspect of compliance, but is the issue is like how deep do you want to get in terms of managing your business associates compliance? And it's a really good question, and one in which it's not as clear as you think. I mean, a lot of people say, we're going to, you have to comply, here are your policies, and you got to do the things in this policy. And that actually can be a problem because it can actually increase the liability of a business associate. And the reason is because of a principle called agency. And is that if you exhibit too much control over a business associate, it's possible that if that business associate had a breach, that they could say, well, we were following the policies that were dictated to us by the covered entity, and it would potentially increase the liability of that covered entity. So on the other hand, you don't want to turn a blind eye. You don't want to say, well, hey. So I'm actually not sure what the right middle ground is, but the thing I do know is they got to have a business associates agreement. And I think that probably beyond that, you don't need to do a risk analysis for them, but maybe if you did an annual 10-question survey that says, hey, have you done a risk analysis? Have you, confirmed you've got the policies? Have you done training? It's probably not a bad idea and probably would be good to do that. I don't think it's exhibiting control, but it's showing some due diligence.
Yeah, and I think you hit on it, Steve. I was going to jump in. I mean, due diligence is certainly the sort of thing that I would like to think folks are doing, irrespective of compliance-related matters. And, you're going to, as you're evaluating these vendors, be going through that sort of process, I would think by default. And even if somebody is is ready to sign a BAA with you, I don't think it's out of bounds to just sort of make sure and follow up and say, okay, you've got some policies and processes in place. Can we talk a little bit more about those, just to achieve some sort of comfort level on your side? Not doing a full risk assessment, but just taking a look at it and making sure that you're not seeing anything that makes you or your organization uncomfortable, so that you're willing to go into it and feel good about that relationship.
Yeah.
We have Najeen from Anderson, South Carolina, I believe, on the phone. Najeen, are you there?
Yes. How are you?
I'm good. Welcome to HIPAA Chat. Did I pronounce your name correctly?
Yeah, Nagin.
Nagin.
Yeah.
Hi, Nagin from Anderson, South Carolina. What's your question for Steve and Rob?
Well, there have been a lot of interfaces with various labs and diagnostics to get that MU dashboard up and going. What kind of risk analysis do we need to perform for those interfaces? I have a vague idea, and I think I'm pretty sure that's what Steve has been in general telling to everybody. By the way, Steve, I do enjoy your seminars and webinars, and I actively listen to you.
Thank you. So,
thankfully
you're
somebody
the first,
does,
so thank
right?
you.
I think it's that resemblance to George Clooney that did it for you.
Yeah, yeah.
Right.
So how do I get my kids to do that? That's the thing. How do I get my kids to do that? So, thank you, Nagin. That's very, very kind. I will say, so interfaces, as we sort of talked about, I mean, it's like, I'm not saying you have to go out and do a risk analysis. I mean, but you want to look, are they a business associate, have them sign a business associates agreement. And then I actually think that as a part of that information flow piece that we talked about, that interfaces should be included as a part of that. You should document that you are doing, maybe, lab tech, is it lab tech? One of the big lab tech requests, yeah, we have an interface to lab and documenting that. And, usually the lab will actually own the asset that's on site. Often they'll own it. It's theirs. But usually it's, there's going to be an interface and facilitate that. So I think it's a good idea to document it, and it's good if you have the expertise to be able to understand the type of interface and how, like I'll give you an example. I'm literally in the middle of a risk analysis for a small practice, and as a part of that, we discovered that they had a third-party vendor that was kind of scooping up data to provide appointment reminders, and so that generated kind of further discussion about how is that being facilitated, how is the data being sent, is it encrypted, things like that, and is kind of right in line with that. So, just understand those kinds of issues, I think, is a good idea.
Yeah. Well, Steve, in that case, we do have a call, patient prompt alert who does the calling for us, and they scoop limited data as needed to make the phone call, and we have a business associates with them because we pay them monthly for this service.
Yeah, yeah. So make sure
I mean, does it still need to go into a risk analysis, or do we need to say we have a BAA with the calling?
So again, one of the things so let's take that to its so my follow-up question if I were conducting with you is like, well, how are they getting the data? Like, are you emailing it to them? Well, that runs into its own sets of issues. Well, I'd say, how are they doing it? Is there some sort of shared folder service? Are you using Dropbox or you
no.
can't? So
they go directly into connect and call.
Yeah, yeah. And so in the case of this company in Florida, they have their own application. The data, it automatically grabs the data and encrypts it. It sends it across an encrypted, and it encrypts the data. It creates an encrypted tunnel to pull that over. I mean, we ultimately said, yeah, this is fine. This looks good. So, those kinds of issues.
Yeah.
But and on the interface too, it's results only. They don't. We give a paper, and then they send back the data results only for the interface for the meaningful use dashboard requirements to be met. We do not let them get in and pull what they want. It's just one way.
Yeah, yeah. So obviously, I can't evaluate that now or whatever, but that's kind of the process you want. That's kind of drives how you might think about it. So.
Great. That's good. Thanks, Nagin. We appreciate your willingness to be live with us.
Yes, live is fun.
Live is fine. Yeah, we just got a couple more questions here that I'm trying to get in before.
Are these live questions too?
Well, I'm working on that.
I'm sorry, I put the pressure on. I did it again. Sorry, Carol. Well, you're a wonderful host. Have I told you lately you're wonderful?
Hey, you've told me I'm wonderful. But I'm looking for a promotion to producer. So.
Carol, you are a great producer. Thanks so much for working.
That's right.
Like,
look at there, you got a promotion on air today.
I love it. I feel like that Roz on that old TV show with Kelsey Grammer.
Yeah.
So you've mentioned this quite a bit. We talked about these templates and tools, and we had a couple people ask about, basically wanting to know how good the tools were. CMS provides tools, as does healthit.gov. They both provide actually toolkits that you can download online.
Mm-hmm. Healthit.gov and CMS, I think it's the same thing, but
I think it might be the same toolkit.
Yeah, I think it is the same. So there are 4 tools that are available. 4 tools that I'm aware of, and there are probably more, but there are 4 that, you know, kind of get bandied about a lot. First, I'll start with the CMS tool. It is, in fact, by a pretty wide margin, my least favorite tool. I don't like it at all. I feel like that it doesn't actually, and I've written an article about why I don't like it. I don't feel like it doesn't actually do a very good job of helping you do what slide A said to do. You know, it has a place where you can put in inventory, but there's no connection between inventory and risk categories and the risk assessment part. And it also is tied to the NIST framework, which is not binding on organizations. So I'm not a fan of that tool at all. However, one of the things that I have to kind of admit reluctantly is that if you were to use the tool and really use it thoroughly and in good faith, this is a tool that's provided by CMS. It would be hard for me to say. I mean, the key thing is using it thoroughly and in good faith or whatever. Can you see I'm torn here? I don't think it produces the results required under the regulations, but, you know, it'd be hard for an auditor to say, well, you didn't do a risk analysis because here's our tool. So I'm not a fan of that tool at all. Another tool that's better but has all kinds of problems that I don't recommend is the NIST.
The NIST,
the NIST
yeah.
is published a tool. Yeah, the NIST tool. The problem with the NIST tool, it has some cool features. It is incredibly difficult to use in that there are 2 kinds of assessments. There's standard and enterprise. The standard questionnaire has over 400 something questions. They are incredibly redundant. I mean incredibly redundant. It's like, hey, haven't I answered this question like 5 times already? It's like, I don't get it. And then the problem again with the NIST is sort of like with that. It actually is not. It does too little and does too much in that it does too much in that you don't have to comply with the HIPAA framework, the NIST security framework. Not complying with the framework is not the same as not complying with HIPAA, and so that is one of the problems. But then there's this just whole issue of usability and redundancy that makes that one not a problem. The 2 that I kind of recommend with reservations are HIPAA is the HIMSS toolkit, and if you Google HIMSS toolkit, it's not bad. It is a spreadsheet. It has different tabs. They're pretty decent explanations on how to use it. It has a place for inventory. It's still hard to use, but they're all hard to use, but it's pretty good. It's like, and the other one that's pretty good is a similar spreadsheet that was actually developed by the National Learning Consortium, and it was actually distributed to a lot of regional extension centers. I'm not a big fan of any of these tools. To be honest, those last 2 I would recommend. Reluctantly. The first 2 I wouldn't recommend at all. The reason is I really do think, I mean, this is self-serving, I know, but really do think that what I do is something that really can benefit from an expert, like, you know, that knows what they're doing. So, you know, I will say that, as I said, you could do an update or review in between years, and I do think that a lot of organizations, I think the update process or review process, you know, is much more iterative. It's, you know, and I think that could be good. But I think there's a real benefit to having a third party conduct a risk analysis, you know, for reasons of expertise. But if you're going to use a tool, you know, those last 2 are the ones that I would recommend. Was that terribly self-serving? Did I just, you know?
Well, yeah, you know, I think that it's not self-serving at all, and I think that we actually had a couple people ask about, you know, being a small practice, what should they do? I mean, you have a product for small practices to help them, and we'll get I think a link out for that. And I think it's like anything, you know, having an outside expert versus relying on perhaps an in-house or a staff member to tackle this would be difficult. And but we're gonna leave it on that. But I promise you, when I get the email out to everybody who registered, that I will include various links.
Yeah. I want to actually say, say one last thing too about that. That I have limited capacity. If you need to get your risk analysis done between now and the end of the year, I have some but quite limited capacity for that service.
Yeah.
And so if you're interested in that, it's called Risk Analysis in a Box Lite. Again, it's for small practices. Please email me like today, because we maybe have about 10 slots open. And, so
quick.
Let
yeah.
me know.
Yeah. And then I do encourage you, EFAC's really wrote a terrific white paper on our High Tech Answers website. It's right at the top navigation under white papers, and it's 6 steps for securing PHI mobile devices. I will also, when I email you, everybody, get you a link to download last month's HIPAA Chat with Steve and Rob, where actually that's really, we talked about encryption the entire time. For those of you who had some more detailed encryption questions, you'll probably find the answer in that HIPAA Chat. And my last bit of information is, we are having HIPAA Chat in December. I think we are having a guest speaker, or guest host.
I'm very sad about
guest host subbing in for Steve, who will be on holiday vacation, which is why he only has a limited number of spots left for his
exactly right,
yeah, exactly. But I'll get his bio to you. He's sounds like Mike is great, and if we like Mike better than Steve, who knows? No, just kidding.
Very possible. No, very possible. So Mike has a perfect radio voice.
Yeah,
I've got to say, he's got the radio voice.
Doesn't look like George Clooney. And please, and
Steve, how open are you on slots with your vacation, by the way? I mean, is it possible for us to get in on that by any chance? Or?
This is a very tender subject here, Rob. Thanks. Twisted eye.
Sorry.
Yeah.
But Rob or somebody from EFACS will also be joining us in December because it's just, having a merry group around us is super helpful. So please visit our sponsor's website, enterprise.efacs.com. Check out the white paper. I will send out an email later today with more information than you guys can possibly handle over a weekend. And my goodness gracious, another HIPAA Chat is over. And thank you again, and we will see you hopefully all in December.
Yes, happy Thanksgiving, everybody.
Yeah.
Happy Thanksgiving to everybody indeed.
Yeah.
Okay.
Thanks, Mike. Talk to you later. Bye.